Hello, I'm Kelly Humphrey.
I'm Damian O'Hare.
And this is our Feasibility Report.
Our Feasibility Report is on universal healthcare in the United States. And as we all know, this is a very controversial topic just now in America, and it's something that affects us all. During our research into the universal healthcare, we discovered a fact by politician Alan Grayson, who claimed that 45,000 people die a year in the United States due to a lack of free healthcare. And we wanted to know what we could do to change that statistic.
We're going to discuss how our feasibility is going to be implemented in the United States and how this will work and how it will affect others.
This presentation is going to cover the current problems of the U.S. healthcare system, healthcare's backgrounds, our plan and methodology, 3 alternative options, the costs and benefits, and lastly, our recommendation.
From our research, we discovered that the main problem was that there was a lack of health plans throughout America. And what we wanted to do with this was give us the opportunity to have people in the United States free access to healthcare, which would benefit millions of people in this country. Given that there is so many people that do not have a health plan, it is important that these people can improve their healthcare through life. This will achieve greater health for each person. Generations, as they grow older, will be healthier and live longer. And as the saying always goes, that kids are the future. As these people will be healthier than their peers, this will then spread down to their generations and onwards. From our research, we discovered a fact by a politician named Alan Grayson, who claimed that 45,000 people a year die through a lack of a health plan. And by finding out this statistic, we had to discover what caused it and how could we avoid the statistic from increasing.
I think it's a perfect segue to talk about the ACA, the Affordable Care Act, also known as Obamacare. The big talk the last few days, last few weeks has been to defund it. We've heard, of course, Senator Marco Rubio. He was on our show for an interview not too long ago, and other lawmakers saying, yes, it was passed. The Supreme Court said it was, it stands, it's got legs, but they're saying we want to defund this thing. What is your take on that?
I think it's an atrocity.
Why?
Because we're talking about life and death for the 50 million people in this country who cannot see a doctor when they're sick. If you take 2 people who are absolutely physically identical, same gender, same age, same weight, same smoking habits, and one has health coverage and the other one does not, the one without health coverage is 40% more likely to die every year. We have 45,000 people in this country who are dying every year because they don't have health coverage. The Affordable Care Act would provide coverage to virtually all of them, and the Republicans like Rubio want to stop it.
In our
I
study,
think it's horrifying.
We studied healthcare systems in the United Kingdom as well as the United States, and we found that in the United Kingdom there's free healthcare, dental care, and also in Scotland you have free prescriptions. This is a large contrast to the United States, where there's relatively little free healthcare and prescriptions are charged. What we wanted to implement was a universal plan where people have the option to have free healthcare as well as prescriptions to help them get better through times of sickness and ill health. The tax rate in Europe is around 20%, and this is commonplace that it comes out of people's paychecks so that it goes to the government, who then spend it on the healthcare. And one of the main differences we found between the United Kingdom and the United States was that in the UK there's one main healthcare system which is called the National Health Service. This was set up after the Second World War, and however this contrasts to America, where there are a monopoly of private health companies such as the United Health Group, WellPoint and Kaiser.
Our healthcare plan would be to implement a 20% tax on American citizens, which would come out of paychecks. This tax will include general healthcare, vision, and dental. In the general healthcare plan, physicals, broken bones, cancer care, pediatrics, and other disease controls will be free. For the vision plan, checkups and prescriptions will be free, along with discount on glasses frames. And lastly, the dental program will include free checkups, cavity removal, and free braces if needed. Our plan is similar to the European models, which have been proven to work successfully in the past.
As mentioned earlier in our study, we discovered, as with the European systems, they are funded mainly through the taxation of their citizens. And we wanted to close this gap that is occurring in a lot of health statistics we were discovering. Particularly from one study, we discovered there were 17 countries in the first world were studied. The US was ranked the lowest for some diseases such as obesity, heart failure, as well as infant mortality and teen pregnancy. And for a first world country, we decided that we had to do something to change this, and we wanted to close the gap between this and the 17 other countries. With the implementation of the universal healthcare, we believe that we can lose these statistics, as well as lowering the number that we mentioned earlier of 45,000 people a year dying due to a lack of healthcare. This will mean that diseases aren't left untreated and everyone will have the right to healthcare and a better life.
3 alternative options we considered would be to have no change or keep things as they are with the Affordable Care Act currently in place. Implement affordable insurance. Instead of charging people with health care excessively, they could be charged just for the health care that they use. And lastly, we could tax the wealthy, which would be anyone who makes over $200,000 per year, at a rate of 40%.
For the impact that this will have, the first impact we looked at was the social one, and we believe that this will give everyone a better chance of living healthier and staying longer, as well as everyone will be on the same level, and regardless of income or status in society, they will be seen to be treated to the best standards available in the country. The long run benefits we discovered were that the stability of a family would last, they would have healthier people through all their generations, and there'd be less financial burden should a family member be sick or contract a disease, as they won't have to pay for the healthcare. We believe this is technologically feasible, as it will come out of paychecks and there will be no real direct cost to the individual with having to sign up online and whatnot. However, the economic practicality might not stand, as people's wages may decrease to deal with having to pay higher tax and lose some of their income, which means they may end up defaulting on mortgages or even loans, which could harm the economy in the long run.
There has been a large outcry for a better healthcare system, which citizens need and deserve. People need a healthcare system they can use freely, because a healthier society will lead to a more productive and happier country. According to surveys and research, people will be extremely supportive and accepting of the new plan that will be open to everyone. The Affordable Care Act has had many downsides, which has caused upset in society. There will be no change to the ecological soundness because our plan has no environmental impact.
In conclusion to our feasibility study, we believe that tax rate of 20% across the board will have a social impact that will outweigh the cost to each individual in the long run. As you mentioned, the long run health benefits will far outweigh the financial burdens that may occur, as we believe that with a healthier society, this will benefit all those throughout the country.
We recommend that everyone be taxed 20%. This tax will come directly from their paychecks to make it easy, effective, and efficient. This universal healthcare system will lead to a happier and healthier future because everyone will be allowed free, unbiased healthcare that is dedicated to the consumer, which is you.
We would like to thank you for listening to our universal healthcare plan, and we hope it has been of some educational benefit to you.
We believe this plan will work across America, and should such a system arrive in the future, we ask that you support it. Thank you very much.